you can learn a lot of different ways to help the person see the depth, but I'll cover a couple things that you may not have heard before. So usually when a person can't see the depth on the Coit's ring or any of the other vectograms, and you just can't see stereo, usually the reason for that is because they're suppressing. And so they suppress maybe the whole Coit's ring with the eye or the weaker channel or the weaker eye. And so that's like when both eyes are open, of course, and you're trying to get them to do the activity. So what can you do? You can, just like with the Brock string, you could blur the better seeing channel with plus. Okay, so in the example of the Brock string, if you were looking at the bead at 50 centimeters, you would take, if you recall, you could take a +4, okay, because it's going to start to maybe blur it around +2, +250, maybe 3. So you want to take a little bit more than that, add like a +4, and see what happens. See if you can blur that more vivid Coit's ring that they see out of the dominant eye enough to the point where maybe the blur matches the blurriness or the fuzziness of the weaker Coit's ring. All right. Maybe the weaker one will start to emerge in that scenario. Possibly, possibly not. You could even try much more plus. You could try 6 + 6 at 50 centimeters, blur it even more and see what happens. All right, so that's one way. But we talked about zone of suppression in one of the previous modules. So let's take, for example, this guy over here with the Polaroid glasses on, and he's 50 centimeters away. And let's pretend that he has amblyopia and he's suppressing his, let's say, his right eye. Okay. Now, is he going, so, okay. There's a Coit's ring, and it's, let's say you've got it on the base out side. And so when you do base out, the Coit's ring will emerge somewhere in space in front of the plane of the card, and you got it on some number, probably not the letters, but some number. Maybe it's you got it on 8. All right, so the Coit's ring will emerge in space, floating out here. All right, now we talked about the zone of suppression. Let's draw the entire visual field of this right eye, this person's right eye. The visual field extends from way out here to somewhere around here, going on the nasal side. So this is the temporal side, this is the nasal side, and it extends way out here. Okay, that's the entire visual field of vision out of that person's right eye. So the ring, the Coit's ring, is obviously occupying the center of their visual field. Right? So what happens a lot of times usually is there's a zone of suppression. They may not suppress everything on the nasal side, so they might have this intact and they might have this area intact, but everything in here is suppressed. Okay, so that ring, since it's right there in space and it occupies that much of that visual field, it falls within their zone of suppression. So you can think to yourself, okay, what can you do to get that out of suppression? You can't just you can't shift it over here. What you could do though is you could move everything closer. So what you could do is move this guy closer. And now the ring is still up here, but now the ring doesn't occupy that whole suppression zone. So let's say this is their suppression zone. Now the ring is so large that this edge and then this edge falls within an area where they're not suppressing anymore, because they're only suppressing right here. Okay, so that's one way you could minimize the suppressed target of the Coit's ring, is just get closer. Make the ring appear in a larger area of your visual field, or make the ring occupy a larger area of the visual field. So what do I mean by that? If you're having trouble understanding that, just hold your thumb out as far as you can away from your face. Okay, and so you see the room and you see your thumb right in front of you, and your thumb only occupies like a very, very tiny part of your field of vision. Now bring your thumb in closer, and get it right basically up to your nose. Now you can see that your thumb occupies a very much so a larger area of your space. So you're way less apt to suppress something that occupies a larger area of space than you are when it's just a little tiny spot within your field of vision. Okay? All right. What can you do to increase the demands placed on the patient when they're working with the Coit's ring? Well, one way you could do it is just separate the targets out farther and farther, and you're in that case, you would be like separating the rings out, and when they're more separate, the ring in the space goes from maybe here to way out in front, and it gets smaller as it gets closer. You could do the same thing on the other side. So you could push base in, and you could move it way over here, and then the new Coit's ring will emerge like behind the plane of the vectogram, and you could just go to where their limit is. So you go back and forth, base in, base out, and work on their limit of their convergence and divergence. But you could also just have them look at one stable target. Okay, let's move this back here. Let's assume you're doing base out again, and the ring starts to emerge here. Okay, and so they're localizing it. Okay, let's say they do have pretty good localization. They can see the target where it actually is in space. You could train accommodation. You could do accommodative rock while they're just looking at this target. So you just keep the two rings in the same amount of separation that you have it right here, and you just do plus and minus flippers. Okay, so put the plus on, keep the target single and stable, flip it over to the minus, keep the target single and stable, and then now you're adding accommodative rock on top of them using their eyes in a binocular fashion and seeing stereopsis. So you could do accommodative rock. You could also incorporate a prism, like a stick prism or prism flippers. So keep the target and hold it as single with base in and then base out. And how much plus and how much minus to use? I would say for when you're doing like binocular flippers, just use anywhere from +1, -1 to +250, -250. That's probably all you're going to need. And in that case, don't even bother like trying to think about the formula with the optical equation to determine their accommodative demand, unless they're a presbyope. If they're 60 years old, you're probably not going to want to like use much minus. It's probably not going to be that productive for them. So instead of doing plus minus accommodative rock, you could just do plus on. So like a +150, keep the target held, or hold the target fused. Okay, now remove the plus, keep the target fused, put the plus back on, keep the target fused. Okay, so that's what you might do with somebody who can't accommodate, like a presbyope. And then with the prisms, start with like a small amount of prisms. Start with about 2 to 4 base in, see if they can do it. So do base in on, base in off, base in on, base in off. And then if you want to add the base out, you could do base in, base out, base in, base out. So you're rocking back and forth with like a flipper. For exos, base in's going to be easier typically than base out. And then for ESOs, base out's going to be easier than base in. So you got to just think about what your goal is for that particular activity on that particular day. Are you wanting to make the task harder, or are you going to want to make it easier? It just depends on where they're at. So, but you want to know how to make it easier or harder, and these are ways in which you can do that. I would say also spend an equal amount of time projecting the quoits ring in front and behind. So you're going to, the base out side of the vectogram, if you want to train base out or convergence, you're going to put them where the digit at the bottom, you're going to see a number. And if you're doing base in, where you're projecting the vectogram target behind the card, you're going to see a letter. Okay, so spend equal amounts of time going in front and behind.